Hello, Rise and welcome back to another video episode. It is Dr. Naza here again. And in this video, we're going to be talking about the STAR method of interviewing. So I think many people might be familiar with it because everyone's using the STAR now. But in case you're not, nurse managers are now using the STAR method to interview nurses. And let's get into it. What is STAR? So S is situation, T is task, A is action, and R is result. So this is basically a way of asking you questions where they expect you to tell them about a situation that happened, what you did, what came out of what you did, and kind of how that wrapped up. So a very popular question can be, tell me about a time where you made a mistake and how that mistake impacted you and your work environment. Now, that's a very hard question to think about, right? But again, you want to be careful because you want to, you don't want to just spill out any random mistake that you've made. You want to make sure you're calculated with your answers. And the good thing about STAR is it allows you to tell a story. So you can build your way to where you need to get to eventually, okay? So here's one I can think of off the top of my head. And this is something I always say. I was a new grad nurse. We were taking orders from the medical resident. I had a resident order a medication. Pharmacy approved the medication. It fell into my MAR and I had to go give it. I went in there to the patient's room and I said, I'm giving a bunch of medications. I'm giving this for this for that for that. And when it came to that particular medication, I said, I'm giving this medication for, and I couldn't think of why I would give her that. But then the patient immediately said, oh yes, I take that at home. So I was like, oh, perfect. So then I give it and she's fine. I leave the room. And I kid you not, probably 2 minutes later, I get a call from the resident. Don't give that medication. It was for the wrong patient. And I'm looking like, I just gave it. So there was panic. I had to go in there, do an EKG for the patient. Thankfully, everything was fine. But that was a defining moment for me. It was defining because I did not stick to my own side of, I didn't stick to what I'd learned in nursing school. I didn't stick to my principles of being a nurse where you always have to have a reason for why you want to give something. If a provider puts something that you don't think, is correct, it's your responsibility to point it out to say, oh, I just want to confirm, am I supposed to give this to this patient? And I'm just asking because it's not on her medical list and I don't see why she should take it. So that was an example, and that's a story. So in that story now, I said the situation, that was me giving medications. I said the task of the particular medication to give and all of that, and the action of, what went on, and the results being that I had to do the EKG, I had to sit down, and it was a redefining moment for me, knowing that next time, trust your nursing, your guts is right there. You learn all those things in school. Decision nursing, decision, clinical capabilities, top notch. Now you've answered that question beautifully well. So what most people do, as I've seen when we interview new nurses, is they tell you something that has not happened, or they make it sound like it has not happened. They'll say, oh, if I made a mistake, we'll listen through, but then that does not answer the question. You're not telling us about something that has happened. Or sometimes you'll say people generalize to say, oh, when I make a mistake, I usually do this and do that to avoid it. You're missing your points from your interview, okay? So most times when you get to have this behavioral interviewing, aka the STAR method of interviewing, you take your time, you tell your stories through, and then you make sure that you're connecting those pieces. You're making sure that there's a situation that happened. You're telling us about what you had to do. You're telling us what happened when you did what you had to do, and then the results of it. Did it go well? Did it not go well? If it didn't go well, what did you take back from that? And if it went well, what did you take from that? So that's that for today's video. It's pretty short, pretty simple. I would go more into details, but for now, this is just your icebreaker for the STAR method of interviewing. Of course, I can most definitely bring up more situations, more questions that we usually ask new graduate nurses during interviews. Have a wonderful rest of your week. Bye.